I love getting in the surf on the weekends, but I can't enjoy any of this if I'm injured at work. Looking after myself when I'm at my job means I can be in good shape to make the most of the things that I love.
A manual task is any activity that requires you to use your body. These can include pushing carcasses along a rail, moving carcasses or cartons, lowering pallets, pulling pelts or hides, and working with live animals. When you are doing a manual task, especially a repetitive one, there is a risk you may injure yourself. Before you start, stop and think about how you can minimise the risk. Knowing the right manual handling techniques will help you avoid injury.
Correct manual handling techniques come down to the 4 Ps: plan, prepare, position and perform.
Planning ahead will mean you have the right equipment and help when you need it. Find out how big and how heavy the load is. While a load might not seem that heavy, if it is an irregular size, then you may need some help. Where possible, always use lifting aids or equipment like a trolley or hoist. Ask where the load needs to go and for assistance if needed.
Knowing where to go and what equipment you will need will help you plan the safest route. If you need someone to help you, ask.
It's important to prepare your body before lifting by standing in the correct way. Stand with your feet apart and near the side of the load. Make sure you can hold it securely and keep the load close to your body.
If you're lifting with someone, be sure to tell them you're ready. No one likes that sort of surprise, so share the load.
When you start lifting, flex your back slightly and bend your legs. Keep your shoulders level and facing the same direction as your hips, toes and nose. Don't twist your back or lean sideways when your back is bent. And don't straighten your legs before you lift it, as you could injure yourself. When you are carrying a heavy item, keep it close to your body. Make sure you can see where you're going and what's ahead of you. Let your body follow your feet when you change direction. Don't twist your body and don't try to shift items while carrying them. If you need to adjust your load, put it down first.
Another tip, if it's too heavy or awkward to lift, pushing or pulling may be a better way to go.
To push or pull a load safely, use both arms and legs to get the leverage to start pushing. Get a good grip of the object and keep your back straight when pushing or pulling. Make sure your feet are in the right position to avoid slipping, and remember to bend your knees.
The main risk factors are created by what you do and the things around you.
There are different types of risk factors that can be direct or contributory. Direct risk factors include the way that you stand, how you move, the force you put into the task, how often and how long you do a task. For example, if you're using a knife that is not sharp enough, you need to use more force. If you repeat this movement for a long time, the risk of injuring yourself is higher. Other factors like the work environment, external elements, or poor work systems and practices can also increase the risk of injury. These are called contributory risk factors. Your work instructions and SOPs will tell you how to do your job in a way that will reduce the risk of injuring yourself or your workmates.
A simple way to reduce the risk of injury is to stretch regularly, especially during your breaks.
Stretching helps move muscles and increases circulation. If you are doing a repetitive task, doing a stretch for only a few seconds may help prevent injuries. Short breaks, known as micro breaks, can also prevent fatigue and injuries. Micro breaks can be taken when there are stoppages on the chain or a gap in your workflow. You can use the break to do a few stretches or go for a short walk.
Learn to spot the break and take advantage of it. Your body will thank you for it. Working in an amateur is a physically demanding job, so you can expect some aches and pains. But if it doesn't go away or it gets worse, you need to tell somebody.
Tell your supervisor if any pain or soreness continues or if you are unable to keep working. You may need to be shown the correct technique to do the task, or you may need treatment. If you require treatment, you will be sent to the first aid room. Explain exactly how your injury happened so they can treat it quickly. Make sure you understand and follow their directions. You may be given a treatment plan and a return to work plan. Let your employer know what is happening and what duties you can or can't do. Your company will have a policy and procedure in place for your return to work. When you return to work, make sure you get the proper clearances and bring any necessary paperwork with you. If you're not sure what's involved, ask your supervisor.
Reporting injuries helps the company investigate any issues and stops anyone else from getting hurt. Proper manual handling isn't rocket science, but it'll have you working smarter, not harder.